We're now in phase 4 here in Illinois, which for a lot of people is pretty exciting because it's opening up some more opportunities that were taken away from us initially, right? So as we move through this, I want to make sure we stay really healthy. What's great is we're now starting to see some studies come out around COVID that talk about basic supplementation that is really helpful. 3 key things: vitamin D, zinc, and selenium. And what's great is we have the research now to support that, and there have been studies to show that the higher intake of vitamin D, as long as it's still within a normal level, is very protective when we are dealing with viruses. There's also a bunch of studies that are now coming out, done on thousands of patients, showing that those that are in areas where we are selenium and zinc deficient, the side effects, if you will, or the symptoms, right, of this particular disease are worse, and the outcome is worse. And in those areas where patients are not selenium or zinc deficient, the outcome is much better and the symptoms are much easier to get through. So a couple key things as you move forward is always checking vitamin D levels and supplementing with vitamin D, especially here in Illinois. We don't synthesize enough through the sun. And if you want to start checking zinc and selenium levels, really easy through a basic blood test. We can make sure that it's sufficient. And if it isn't, or it's even borderline low, we start supplementing now most of our patient base with selenium and zinc when appropriate to help make sure that as we get increased exposure, right, we're opening things up. Some of us may be a little more nervous, some just more excited, but as we're being exposed, we want to make sure that those numbers still stay down, and zinc, vitamin D, and selenium may be a really good answer for you.